Hey, so this is the technique that I use. So 25.1, it's basically this measurement right here. It's either slightly different, at least from my experience so far. And let's get started then. Okay, so one thing you can do, you could technically reuse these teeth to some extent if you just yank out the gutta percha. I was using the endo explorer. This little thing, you just jam it really deep into the gutta percha and yank fast, and it just comes out. And why am I saying this? I'm saying reusing in terms of after you make a perfect one, plan for contingencies. Like you see here, the apical foramen's like clearly open because I purposely like overworked it. See, it's obviously too far. But this helps you plan for contingencies. What if in your exam you go too far, etc. And then that's when you start practicing. Oh, step up cone size, or cut the tip after it goes in too far. So now we're gonna get started with the gutta percha measurement that I use. So basically, you're going to take a 3504, and you're just gonna jam it into the canal. We know that the canal's at a full length of what was it, 25.1, right? So you jam it in as far as it will go, basically until it stops. Give it some good force. Oh, I bent it. Whatever. You grab parallel, see, like, or not parallel, intersecting exactly with the incisal edge, and then you just pull the tooth out. I'll do it again because I bent this one. So I found to prevent bending, it kind of helps to not only push down like this, but also stabilize with another finger on the top, with your other hand while you push down to get as far in as it will go. And then, like I said, intersecting, yank it out. Then you measure exactly where you grabbed it without moving it. You measure, and we see it's at 23.4. So we're well within the limit of 2 millimeters before the apex or whatever it is. So now we can take the next step and cutting. So we know the root is at 15.5. That means we're going to measure around 15.5 and cut, because we know that this can't go any further. With enough force, it'll just bend. You'll get that. And that's when you know you applied enough force at the end. So we're going to use that stub at the end to put sufficient force to push it down and not any further. Going to be cutting at 15.4, which just coincides with the first line. And if we match it up, you see it's roughly the same as the first line. So that's where we're going to cut. So now that we did the full measurement, you're going to coat this in your paste, and you literally just pop it in. I don't really smear it around with a probe or anything. I just pop it in with the paste. In this case, I'm not using it, but whatever. Then you're gonna take your stub, jam it on, push, and if you really want to be over the top about it, you could verify here at the incisal edge, and that basically looks about how it was at the when we first measured. So that's one way of doing it quick without having to take out a probe and measure. You could also mark it or whatnot, and then to use the appropriate amount of force, just continue jamming it until the stub basically gives out, and then you basically verified you put enough force in there. You could continue to push it in or whatever, because the taper is going to prevent it from going too far in, but that should be fine. So now we know the length is fine. It should be fine on the apex too, according to our measurements. And all you have left is just to sear it off. We could verify by just yanking it out and checking the apex. See, it's basically right at the tip. Maybe 1.5 millimeters off, but it's well within the 2 millimeter margin of error. Now for the molar, I don't know if you can tell, but there's a slight ledge on this tooth. I'm going to take it out and show you in a bit, and then the technique I use to smooth that out. Because as you can tell, I'm literally right at the border where it's considered a fail. I extended mine pretty largely. So I don't want to start using an endo Z because I could encroach on that space. And I'm going to be very conservative now to fix that. Technically the ledge, I don't think it's part of the criteria, but you should still address it if you can, because the glide path, see, should be smooth. Either way, you can see that clear ledge right there. We're gonna fix that. It's not really important on this tooth because on the actual canals, it slides easily. But on that buccal wall right there, there is a slight ledge. So we're gonna fix that with a hatchet. So, like I said, this doesn't really matter for the exam unless it's on the actual canals and inhibiting your glide path or whatever. But that's it. You basically just go here on the side and try to just smoothen that out little by little. It's nice and soft because it's not actually the enamel. So just very gently do it. Just scrape it slowly. See, it just starts coming off. And it makes it incredibly smooth. This is one little thing you could do. So, like I said, you don't have to do this on a brand new tooth. Just take old teeth, mess them up, or just go completely to the ADEX max and just plan for contingencies because you never know when it happens on the day of the exam. Anyways, hope this helped. This is basically how I practiced messing up teeth. I have an example here of when I purposely like just completely open the apex to help me plan for over prepping or whatever, over instrumenting, and in case it comes out the bottom, etc. So just, I don't know, play around, see what works, plan for problems, and I guess learn how to fix them. So a few extra tips. If you notice the picture that's on the screen right now where it says RCT, that's something I did for organization, and it kind of goes hand in hand with the procedure to begin with. Root canal treatment, but in this case it's root length, crown length, and then the total combined length. And that just makes it so much easier for you to properly plan out your procedure, right? So when you saw when I cut my gutta percha at 15 point something, they allow you to be over, I think it's 3 millimeters. Just check on your candidate guide what it says. But I do recall they let you be over the cemento enamel junction a bit, and then below a bit. Same with the apex. So using those measurements, you can get it right on point. Another tip is if you are not going to proper length, let's say you keep working it, you don't want to overwork it, and you're not at the 2 millimeter limit, slightly below it, go up a size, right? So if you're doing size 30 cone or 35, whatever, go to 40. Same with the file. You could get a rotary file for a step higher. And I found that that helps too. Or you could use a cone that's slightly smaller. Go down, cut the tip, make sure it's fitting right. Just play around with it and get your proper technique down. Because that's what I did for the most part. Just reuse the same tooth, play with it. Go up a cone, go down a cone, overwork it purposely, right? If you did up to 35, go to 40, whatever. And just get a feel for it. You can also purposely open the apex and expand it to give you a feel for how it feels if you do that during the exam, right? If you purposely overwork it, and now you're going to have to either go up a size cone or snip the tip so you're not extruding out, right? So just some tips. Those are some issues that I came across. Also, when it comes to working inside the actual canal, if you're going to clean, that's fine for the molar, but be careful with the anterior incisor. I had an issue related to over tapering the upper coronal third of the orifice on the incisor, and that was because on my file, because I wanted to clean it really well, I would lean it left, right, maybe twirl it a little bit, just keep it straight up and down. If not, you're gonna taper the top and the cone's just not going to fit that great. Same thing when you're using manual instruments like the spoon or even the hatchet. Don't use it for the incisor, obviously, for the exam at least. That can cause you to do some weird anatomy inside because that fake dentin's pretty soft. So I would just work it really nice and soft with the spoon to make sure you get all that wax off. And then just go straight to your rotary, because it's really not that dirty in there, and it comes off pretty easy. I was just using mouthwash as my irrigant. That was pretty fine. And speaking of irrigation, at the end, make sure to clean it very well, because that could be another issue related to you not going to the proper length or full length, or being below 2. Is that it's simply dirty. If it's not actually open in the apex, which for my exam tooth, it didn't look like that at all. It looked like it was practically sealed. So if there's dirty stuff left behind, let's say debris, pieces of dust, whatever, a mix of wax and mouthwash or whatever solution you're using, that kind of compacts and prevents you from going full length, right? Just physics, right? So just make sure to rinse it really good. Use a good amount of paper cones. Go through like 5 of them. Good amount of rinses. Just take your time. You have more than enough. I literally finished the exam in under an hour, at least for this section when I had to retake it. So you could just take your time. Be meticulous with it. Just do every little step, nice and slow, and get a feel for it. And like I said, just reuse these teeth. Really go ham on them. Mess them up, and figure out how to fix it, just in case on the exam day it's different, which it is, because these practice teeth are totally different than the exam teeth. So just have a feel for it.